when we start talking about doulas and we're talking about, people being informed of perinatal mental health conditions, this really gets down to access, right? Access of care. And whenever we start going down that path, I start thinking about healthcare disparities, amongst people that look like me, especially when you look at, Black women in terms of health, especially in terms of birth. Like we have higher death rates, right? We have all of these things. So it's probably no different in perinatal mental health conditions. I'm sure we probably have higher rates from what I'm seeing too, right?
If you're looking at general population's chance of having perinatal mental health condition for women is about 1 in 5, or let's say 20%. For women of color, in particular, Black women and Latina women, it shoots up to about 40%.
Wow.
Which is a huge. I mean, that's like almost half the population, and those are people. Let's just say that we can sort of count that have in our statistics. That's not counting the people who have like maybe a subclinical presentation and they don't meet every criteria for a perinatal mental health condition like postpartum depression. But even if you don't have depression or anxiety, it doesn't mean you're not impacted by the change or the system that you gave birth in. The rates of maternal mortality are much higher for Black women and Latina women, and frankly, a lot of women of color. So the rates of perinatal mental health conditions are much higher. And some of the reason for that is racism, honestly, systemic racism. And as I mentioned before, implicit, explicit bias. There's a long history of it pains me to say it, but using Black women for experimentation, for gynecology in particular, and wherever that thread started, it still is in there. And it's hard to share that statistic because it's also scary to hear that statistic. If you're a Black woman who's going into birth, and that stat, then it automatically increases your stress.
Yeah.
Because you're worried about that. So having providers that look like you, or having trauma-informed providers, finding people who can support you like doulas, getting connected with organizations that support Black and brown women in their birth. And those are all ways to help reduce that fear.
It's so funny. And I think you heard my mom talking about this at some point. When I was born, and my dad is drug addict, right? And so when my mom was a single mom, when I was born, like, I guess my dad was like gone, like nowhere to be found. And I'm sitting here thinking about it and I'm like, oh wow. Like we were in Florida and my mom was there like by herself, like no family. My mom makes a phone call to her dad and my grandfather's like, that's it. And then my grandma comes and they move, my grandma says, okay, you're moving back to Sacramento, right? I mean, I'm just thinking about all these things, all these like situations and scenarios that I have never given thought to that contributes to my mom's mental health during that period. And honestly, like from my mom's perspective, from my perspective as an outsider looking into a specific scenario, I'm like, damn, my mom was kind of a badass to be able to handle all of that and to continue to strive through. But like, she shouldn't have to.
Right.
And there should be support